Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, what are the prognostic and predictive? What are the prognostic and predictive factors of for invasive breast carcinoma? What is the prognostic and predictive factors for invasive breast carcinoma? Okay, first we will see tumor factors. Tumor factors include nodal status, tumor size, histological or nuclear grade, lymphatic or vascular invasion, pathological stage, hormone receptor status, DNA content, especially like ploidy or S phase fraction. Then we have extent of intraductal component. Then we have HER2 new expression. Then we have host factors. Host factors which have prognostic importance are age of the patient, menopausal status, family history, previous breast cancer, immunosuppression, nutrition, prior chemotherapy. Then we have prior radiotherapy or radiation therapy. So these are the main prognostic and predictive factors of invasive breast carcinoma.
thank you and thank you for watching.